Thank you for watching, and be sure to talk to your healthcare provider if you have any questions or concerns about your medications and any health conditions you may have. Disclaimer: the information presented in this video is for educational and informational purposes only. It is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you hear or see in this video. Introduction: cholinergic signaling is a vital component of the nervous system, playing a pivotal role in various physiological processes such as muscle contraction, heart rate regulation, and cognitive functions. Cholinomimetics are a class of drugs that mimic the effects of acetylcholine, ACH, the primary neurotransmitter of the cholinergic system. These compounds can be broadly categorized into two groups: direct-acting cholinomimetics and indirect-acting cholinomimetics. This video delves into the intricate world of indirect-acting cholinomimetics, exploring their mechanisms of action, therapeutic applications, and potential challenges. Mechanisms of action. Indirect-acting cholinomimetics, also known as cholinesterase inhibitors, target the cholinergic system by impeding the breakdown of acetylcholine through enzymatic inhibition. The two major types of cholinesterases in the body are acetylcholinesterase, ACHE, and butyrylcholinesterase, BUTCH, which hydrolyze acetylcholine and other cholinesters, respectively. By inhibiting these enzymes, indirect-acting cholinomimetics amplify cholinergic transmission, leading to an accumulation of acetylcholine in synapses. Types of indirect-acting cholinomimetics. 1. Reversible inhibitors. Reversible cholinesterase inhibitors interact with the active site of the enzyme, forming a reversible complex that can eventually dissociate. These inhibitors can be classified into two categories: short-acting and long-acting. Short-acting inhibitors, like physostigmine, are used primarily for diagnostic purposes due to their rapid onset and short duration of action. Long-acting inhibitors, such as donepezil and rivastigmine, are widely used in the treatment of neurodegenerative disorders like Alzheimer's disease. 2. Irreversible inhibitors. Irreversible cholinesterase inhibitors form a covalent bond with the active site of the enzyme, rendering it permanently inactive. Compounds like organophosphates and carbamates are examples of irreversible inhibitors. While organophosphates, example sarin, soman, have notorious associations with chemical warfare agents, carbamates, example neostigmine, find application in clinical settings for conditions like myasthenia gravis and reversal of neuromuscular blockade. Therapeutic applications. The therapeutic applications of indirect-acting cholinomimetics are vast and varied, owing to their ability to enhance cholinergic transmission. Some key areas of application include: 1. Neurodegenerative disorders. Indirect-acting cholinomimetics have shown efficacy in managing cognitive deficits associated with neurodegenerative diseases such as Alzheimer's and Parkinson's. Drugs like donepezil, rivastigmine, and galantamine are commonly prescribed to alleviate cognitive symptoms and improve quality of life. 2. Myasthenia gravis. Myasthenia gravis, an autoimmune disorder characterized by muscle weakness and fatigue, is treated using indirect-acting cholinomimetics like neostigmine and pyridostigmine. These drugs enhance neuromuscular transmission and ameliorate muscle weakness. 3. Reversal of neuromuscular blockade. During surgical procedures, neuromuscular blocking agents are used to induce muscle relaxation. Indirect-acting cholinomimetics such as neostigmine and edrophonium are employed to reverse the effects of these agents and restore normal muscle function. Challenges and considerations. Despite their therapeutic potential, the use of indirect-acting cholinomimetics is not without challenges. 1. Side effects. Increased cholinergic transmission can lead to adverse effects such as nausea, vomiting, diarrhea, and excessive salivation. Finding the right balance between therapeutic benefits and side effects is crucial. 2. Dosage titration. Due to the variability in patient response and the potential for adverse effects, dosage titration is often necessary. This requires careful monitoring and individualized treatment plans. 3. Drug interactions. Indirect-acting cholinomimetics can interact with other medications, leading to unwanted effects or diminished therapeutic outcomes. Health professionals must consider potential drug interactions when prescribing these agents. Conclusion: indirect-acting cholinomimetics, as cholinesterase inhibitors, play a vital role in modulating cholinergic transmission. By inhibiting the breakdown of acetylcholine, they offer therapeutic options for a range of conditions, from neurodegenerative disorders to myasthenia gravis and surgical procedures. However, their use requires careful consideration of potential side effects, dosage titration, and drug interactions. The ongoing research in this field holds promise for further understanding the mechanisms of action and the development of improved therapeutic strategies involving indirect acting cholinomimetics.